Good morning. My name is Megan Pearson. I'm the Chief Communications Officer for Kern County, and this is the COVID-19 briefing for Monday, June 22nd. Today we have with us our Director of Public Health, Matt Constantine, and our Chief Administrative Officer, Ryan Alsop. I'm going to hand it over to Matt to begin.
Good morning. Thank you, Megan. This morning we are announcing 75 new COVID-19 positives in our residents and 0 additional deaths. A brief update on our skilled nursing facilities. We continue to hold daily conference calls with all of our skilled nursing facilities to review their current statistics, their needs, their staffing requirements. We are still trying to reconcile numbers, so I don't have current numbers to provide you, but those daily conference calls continue every day. Our skilled nursing facility testing team continues to be active this week. We are at Height Street Skilled Nursing Facility today. We will be at the Kern River Transitional Care Tuesday and Wednesday, and at the San Joaquin Skilled Nursing Facility on Thursday and Friday. And then finally, the state has notified us that the drug remdesivir will have another shipment arriving hopefully this week of 367 doses. They have indicated there may be one future allocation towards the end of the month, but this current allotment should arrive this week. With that, I'll turn it back over to Megan.
Thanks, Matt. Just a quick update on our testing sites. We've completed over 9,800 tests so far. I want to go make a quick number of updates on our testing sites so that you're aware. The state-provided sites remain open in Arvin at the Public Health Building at 204 South Hill Street. At the Kern County Fairgrounds, that is now a drive-through location. It is at Gate 26. There used to be a site at Gate 40. It is no longer there. A quick update on that site as well is it only accepts patients who are 18 and older. So if you have children, you need to visit one of the other sites. The Wasco location at the library there remains open, and the Mojave location has moved to Rosamond. That's at 3200 Glendower Street in Rosamond. The county sites also remain open. Oildale, Taft, Delano, Kern River Valley, Ridgecrest, Tehachapi, and Lamont are also open. There's a note about Lamont. They offer testing to children 5 and up. So just be aware if you're using that location, anyone under 5 is not accepted, and always the parents need to be there to provide consent. I'm going to turn it over to our Chief Administrative Officer, Ryan Alsop.
Good Monday morning, everybody. Hope you all had a good Father's Day weekend. Today in Kern County, population 900,000 plus. We've tested 49,000 of our residents for COVID-19. 44,293 of those tested, or 91% of those tests, are negative. We are seeking the results of 674 residents who have been tested, or about 1% of the total number tested. 3,965 residents, or 8%, have tested positive. And today, of that number, the 3,965 residents who've tested positive for COVID-19, 3,839, or 97%, are either fully recovered or are isolated at home, recovering, treating their symptoms on their own. Today, 66 residents who've tested positive, or about 2%, are isolated in the hospital. And we've had 60 deaths, unfortunately, about 2% of the total number of positives. Quickly on the Kern Recovers program, the forgivable loan program for Kern County small businesses. We have distributed out nearly $7.2 million in funding to 273 different businesses across 126 different industries. The average loan is about $25,000. It's taking 15 days from time of application to getting money in your bank account. Anybody interested in getting that financial assistance, if you are a small business whether you were essential or non-essential under the governor's orders over the last several months. As long as you have not received any federal assistance like PPP or other programs, you can qualify to receive financial assistance from the county. You can go and put in an application at kerncounty.com. Our PPE program, Personal Protective Equipment Program, that we're going to be launching on July 1st. That's a $5 million program for area small businesses. We're targeting 5,000 small businesses to receive PPE equipment. Again, that program will launch on July 1st, and information on that program will be going up on the county's website at kerncounty.com in the coming days. So look for that. And with that, I will hand it back over to Megan.
Okay, we're ready to take questions from the media. We do have a couple of unknown callers on the line, so we're going to go through our typical order as it's been given to you. And if there are any others who were not called upon at the end, we'll take those calls. So our first outlet is Channel 17. Do we have anyone on the line with questions?
Hey, Megan, Ryan, and Matt, it's Eitan. Good morning to you. The first question I have just a few today. You know what, we're getting a lot of viewer emails, messages about the following, and I'm just gonna quote the question. How do you turn in a business that is not following the governor's mask orders? And Mr. Constantine, what can you do about it?
We're going to have Matt respond to that, Eitan.
Eitan, good morning. Thank you for that question. We have received similar questions at Public Health. Let's first understand this is a state guidance document that was released, and that is mandating the use of face coverings in most situations. The state has not provided the county with any detail yet about how they anticipate enforcing this order. We did see in the media that the state had made mention that this could be potentially enforced by Cal OSHA, and that it is a misdemeanor, and there could be fines associated, all administered at the state level. Our position at the county level has remained the same with all these guidance documents. We want to make sure that we get the information to the public. We want to make sure that they have the most up-to-date information so that they can protect themselves and their family. We expect our community and our businesses to comply, as they have done a great job. There's a lot of reading, a lot of documentation on these guidance documents. Every industry has its own. Some overlap. I'll say honestly, some appear to contradict in some locations. This is a complex, ongoing, dynamic discussion that we have with our businesses and with the state to try to get clarification and do what's best. With that said, if we need to help focus some of our efforts, our education and our awareness in certain areas, we'd be happy to do that, as we have from day one. This is a new requirement. It's going to take some getting used to. There's new expectations. We know that local businesses are trying to understand it and to adapt. Some are corporate-owned and have the ability to make significant and on-the-spot changes. Some take a while to develop some wording and some signages and put some information up on the website. So we understand it may take some time, but we're in this together. We'll figure out how to do it. We'll make sure our community is safe. But it's just going to be an ongoing process. Eitan, did that answer your question?
Thank you, Matt. Thank you. I deeply appreciate that. Let me just quickly ask you, is there a place though you recommend somebody should call or email, anything like that?
So Eitan, again, we're looking forward for direction from the state on if there is a centralized way to address that. At Public Health, we can certainly try to assist, try to bring greater awareness. Our hope would be that through these press briefings and social media and our dedication from our community, that together we will align and adhere to these requirements. But yes, we are a resource.
Thank you, Matt. And final question for me is just, I know you and I have had many conversations about skilled nursing facilities in the past. As I believe the state did write me by saying that they have received, and I quote them, 100% they have received from, quote, 100% of all current skilled nursing facilities a development plan for testing. As far as you know, did you hear the same thing?
Eitan, I have not heard the same thing. The state several weeks ago, maybe even a month ago, put in a requirement, they call it an all facilities letter, to all of our skilled nursing facilities to develop a plan to test within their skilled nursing facilities. As I've told you before, our interest was to not wait 3 weeks to develop a plan, but to actually start testing now. Our hope is that those plans have been compiled and submitted, but more importantly, are being followed, because it does require not only that initial testing, but a testing frequency that is aggressive. I believe if there were positives in their employees, they have to do it every 7 days. If there's negatives, it's every 14 days. So it's ongoing testing. I'm hopeful what your comments are is correct. As I've just mentioned earlier, we're still going into facilities and testing ourselves. So it sounds like it's still ramping up. But certainly that is our expectation, that every one of those skilled nursing facilities implements an aggressive testing plan.
Thank you.
Thank you.
Okay, we're going to go to our next outlet. I am going to ask that, because we do have a number of additional outlets on the line today, if we could keep our questions brief. We're still going to let you ask as many as you have, but if you could keep them brief, that would be helpful. So *6 to unmute. Our next outlet is KNZR. Is there anyone on the line with questions? Okay, our next outlet is the Bakersfield Californian. Anyone on the line with questions?
Hi, yes, this is Casey Shepard with the Californian. My question is kind of a technical one. Ryan, in his report, said that there's 66 residents isolated in the hospital. Now, the state's website for tracking hospitalizations is showing 103 hospitalized as of yesterday. Can you guys provide a clarification on that? I know sometimes these numbers include people from outside the county that are non-county residents. Is that accounting for the full discrepancy there, or is there something else?
Stacy, we're going to have Kim Hernandez, our lead epidemiologist, respond to your question.
Hi, Stacey. Good morning. One of the biggest differences probably in the numbers is that the state's numbers come from a bed poll from the hospital. The numbers that we have on our Kern County dashboard come from the either speaking with the individuals who are hospitalized or with infection control. We're actually looking at two different things. The bed poll with the state numbers is looking for any patient who is in the hospital who has a COVID positive test. On our dashboard, we are reporting the number of people who are isolated in the hospital. And so what can happen, in addition to what you mentioned of non-residents being hospitalized in Kern County hospitals, is that in some instances, patients who are in the hospital are released from isolation. And so then they fall out of the isolated in the hospital numbers that we have on our dashboard, but they do stay in the state's, the bed poll where the state pulls their numbers. So they are still in the hospital, they are still COVID positive, but they are no longer under isolation. And so that's part of the discrepancies. Again, you mentioned that there are also patients who are not Kern County residents, so they don't show up in our Kern County dashboard. But that's probably the biggest difference that you might see.
So just really quickly on that, is there one then that's more accurate than the other or more representative of the other? Or I'm sorry, more representative than the other of people who are actually hospitalized because of COVID?
So they're looking at two different things. And so depending on what question you're asking, the dashboard and the state numbers with the bed poll answer different questions. You know, from a public health standpoint, what we have on our dashboard is we're looking at the number of people who are either isolated in the hospital or isolated at home because they are the communicable disease risk. If they are still isolated, they are likely to still be infectious. Once they are no longer infectious and a communicable disease risk in our community, they come out of that isolation numbers. And so that's what our dashboard is looking at and trying to inform our community about the number of people in our community who we know to be infectious. The hospital bed poll is looking much more at the number of patients in the hospital. Neither one of them specifically is looking for they were hospitalized due to COVID. We do know a lot of patients who have COVID have underlying conditions, and so their hospitalization may be more related to an underlying pre-existing condition than it is to the COVID-19 infection. But the numbers in and of themselves don't tell us which one. Does that help, Stacy?
And I'm sorry, it does help. I just have one more clarifying question. When the state is talking about number of hospital beds available, that sort of thing, ICU beds available, are they looking at their data or the county's data?
I couldn't tell you for sure, but I would guess that the state is looking at the same data that they are reporting out.
Okay, thank you.
Okay, our next outlet is Kern Radio. Anyone on the line?
Yes, good morning. It's Ralph Bailey from Kern Radio.
Good morning, go ahead.
There are several stories today dealing with the increased number of patients in several states across the country. And the other trend that they're noticing is that this wave of patients are sicker than previous patients. Is there any evidence of that here? And I have a follow-up as well.
Ralph, I think we're going to have Kim respond to that. Give us just a second.
Hi, Ralph. Locally, we do not have any evidence that the more recent patients are sicker than other patients. You know, we do know that we are having an increasing number of patients in the hospital, but that also is correlating with the total number of patients that we are finding. So we don't have any evidence here locally that patients who are currently ill with COVID are any sicker than patients we had early on.
Thank you. Are we going to get any more information on the deaths outside of the nursing facilities in terms of demographics, who these people are, age, things of that nature?
That's another Kim question, so we'll turn it back to her for a second.
Hi, Ralph. Unfortunately, at this time, we are not able to provide more demographic information in relation to patients who have been in the ICU or who have died. This was discussed with our data expert when we were developing our dashboard, and the dashboard allowed for us to provide that demographic information for the cases throughout Kern County because we are dealing with a larger denominator of, approximately 900,000 people in our community. When you narrow that down to the number of patients in an ICU at a given time or the number of people who have died at a given time, that denominator gets much smaller. And as that information doesn't provide additional information about risk in and of itself at a localized level, that was something that was determined not to be for us to provide at this time.
All right, thank you. And one final question. I know I've asked this before, but the state guidelines have changed. Why are law enforcement not wearing masks? I saw it as late as this morning, a BPD officer interacting with somebody not wearing a mask. Is this not a concern of the public health department? And have you all spoken with Chief Terry or Sheriff Youngblood about this?
So Ralph, as we mentioned the last time, the question should be directed to either our Sheriff Donnie Youngblood or the Police Chief Terry with the Bakersfield PD.
So this isn't a concern of the public health department. You all wouldn't step in and say, hey, you guys might want to be masked up?
Again, we would recommend that you contact the sheriff or the BPD. Our next outlet is Channel 23. Anyone on the line with a question?
Yeah, hey, good morning. Bayan Wang here. I have a quick question for Ryan and a quick question for Matt. We'll start off with Matt. Good morning to you. Hope all is well. I know last week you were expressing, that mass gatherings should be avoided at all costs, of course, during this entire pandemic, but you did reiterate that last week. So are you at all concerned about the Kern High School District moving forward with graduation ceremonies? What would your advice be there?
Bayan, we'll have Matt respond.
Good morning, Bayan. So yes, it's important to recognize again that the governor's stay-at-home order remains and that community gatherings should not occur. The high school district and other elected boards, school boards, have been trying to find ways to honor the children and their work while still not presenting a risk to the community. I know that different school districts have evaluated different processes from drive-through or processional kind of events in a car to very small, limited settings. So our advice is, of course, to do everything possible to protect our community. I know this is a time to celebrate, and although we might be able to separate during a ceremony, people are anxious to get together and hug each other and acknowledge the work. So our advice is to do everything possible to try to keep those gatherings down, either postpone them or cancel them for this point, or do them virtually as we do a lot of our Zoom meetings now. There's other ways to do it. So we're anxious to work with everybody. We just need to recognize that we have some work ahead of us. We don't want to negate the work that we've done. This has given us time to develop some of these guidelines and to make businesses safer. But there's still a risk and still a challenge out there. Hopefully that answers your question, Bayan.
Sure does. Thanks, Matt. Okay, just pivoting to Ryan really quickly. Ryan, I know you and I spoke a little bit about being in compliance, not being in compliance. So I guess my question is, are we still on the watch list? Are we still, to the state's standards, not in compliance? And does this imply that we have to scale back at all with any of our operations in the county?
We'll have Ryan respond.
Yeah, thanks for the question, Brian. Today we're in compliance across the board with all of the state's county variance criteria. If you go to the state this morning, it will show that on the 7-day average testing positivity rate, we're over 8. That is, if the state holds true to how they have been operating, by early afternoon, that number will change and go down, and we'll have check marks across the whole gamut of state data. So today, the county is in compliance with the state across all of their data points, percent change in 3-day average of hospitalization rates, 7-day average of testing positivity rates, the case rate per 100,000 over a 14-day period, all of those. And I'll say this again, Stacy Shepard from the Californian, I know she's on the line, she's asked a lot of questions about these markers. It's likely that we will be in and out of these markers periodically in the weeks ahead. We have been in the previous days. There may be one marker where we trend upward and get out ahead of it, and then the numbers come back down, and in some cases go well below the numbers that the state is requiring us to operate under. The percent change in the 3-day average of hospitalization patients today is 0% in Kern County over a 3-day average. So to answer your question, we are monitoring this data. We're doing so with the state. The state's watching us. We're in compliance today. I suspect we'll be in compliance tomorrow. We may be out of compliance across any one of these the next day and back in. So we're going to go in and out. The key is that we have targeted discussions with the state on all of these areas, and where we are trending, where we see worrisome trends happening, we figure out how to mitigate those trends, figure out why they're happening, how to fix them, how to get the numbers back into alignment, and that's really the position that we're currently in with the state, and not unlike the other 57 counties in the state. So I hope that answers your question.
Yeah, it does. Thanks, Ryan. Appreciate it.
Our next outlet is Kern Soul. Anyone on the line?
Hi, good morning. This is Elizabeth with Kern Soul News. My question today is about the PPE program that Ryan was talking about. I know you guys said that we can expect more information this week, so I'm not sure if you can answer these questions, but my question is this a program that small businesses are going to have to apply for, and is it specific for certain industries, or is it for all businesses?
Yes, so the Kern Recovers website will actually be updated in the next week with information that will tell businesses how they can apply. They do actually have a process that they're going to have to go through. We're still working on some details around that. We do want to verify that the individual picking up the PPE does indeed work on behalf of an organization. It is not specific to industry, so it is any local small business. So it's, again, any Kern County business with 200 employees or less will be able to apply, and then they'll set up a time where they can pick up their PPE at one of the 16 locations.
Thank you, Megan.
Okay, our next outlet, we're not sure, but we think we may have somebody from Mojave Desert News on the line. Nope, okay. Our next outlet is Telemundo. Anyone on the line with questions?
Can you hear me?
Yes, go ahead.
Yes, can you hear me?
Yes, we can. Go ahead.
Okay, I'm sorry. Good morning. This is Norma Gaspar. Okay, I have a couple of questions, and I'll be quick. Last Monday, we had a total of 3,377 positive cases. Today, we have 3,975. I'm thinking that the addition of some of the Kern County testing centers, it's the reason why, we're seeing an increase of numbers, a spike in numbers, and especially the sites in Arvin and Lamont, where a lot of people don't have transportation in those areas. So the addition of these testing centers is great. I'm hoping that these centers will remain open well after schools reopen, especially like in the Lamont and Arvin area. So we'll see what happens. But my question is, can the Department of Health provide numbers of tests provided for the week in each county site? Especially Lamont and Arvin in the areas where the numbers are high. I know you guys are busy, but I think it's important that we know how busy, that we prove, that people are taking advantage of those sites. And those that show, not a good number, we can encourage people and remind them that it's important for them to, to take advantage of them. So do you think in the near future we can get that information from the Kern County Department?
So Norma, I actually have all of that information. If you'd like it, I can send it over to you. I don't happen to have it with me right this second, but I can get it right after this and send it to you. It is a really valid point that you bring up, especially with the state-sponsored sites. They are dependent on usage. Our ability to keep those sites open is directly tied to how many people are using them. It's also a reason why we've worked really hard to get advertising out to all of our communities, especially those that have a state-funded site in their area, to make sure that we're able to hang on to those. But we do have information about both the state-funded sites as well as the county-funded sites that I'd be happy to send to you.
Please do so, and we can make a weekly segment, just to follow up on that information, which, it's very, very important. Now, the second question that I have is this. National media reports, they are reporting people who have been diagnosed, they have recovered, but then later test positive, for COVID-19 for a second time. Have we had any local cases of anyone testing positive for the virus? And would you recommend that people get retested, even if they have recovered or if they are asymptomatic?
Norma, I want to make sure I heard your question correctly. You're asking if we've had anyone who has tested positive and then recovered and then retested positive again.
Yes.
Or become sick again, right?
Yes.
Okay.
But someone who is recovered,
Right.
and then for some reason, get the virus for a second time.
Let me have our lead epidemiologist, Kim Hernandez, respond.
Okay.
Hi, good morning. The short answer is that we actually do know many patients will continue to test positive weeks to months after their clinical illness has recovered. What CDC has mentioned about this phenomenon is that people can test positive. The current PCR test, the molecular test that we are using, can detect very small amounts of viral particle, but that does not always correlate with live virus. So that even though they may test positive with the given tests we have now, that they may not have infectious virus. And that's part of the reason the CDC has a release from isolation pathway that does not require people to have negative test result. We've seen off the cruise ship, this has been mentioned before, but particularly off the cruise ships where patients were followed very closely at the early, in the first month or so of COVID-19 cases hitting the U.S., those patients were followed very closely, and they continued to find patients who were positive more than 2 months after their illness and after they had recovered. And so we want people to be careful about being retested. There is no general recommendation to be retested. Healthcare providers may do this depending on the patient. At the health department, we follow CDC's criteria to release patients from isolation because we do know there are many instances where people continue to test positive after their illness has subsided and they have clinically recovered, but that those positive test results don't always correlate with live infectious virus.
So what would be your recommendation in general?
So in general, a recommendation is always to follow the guidance of your personal health care provider. We do not routinely recommend that people retest until negative. There are instances where healthcare providers want it, but that is not a blanket recommendation from CDC or the Kern County Public Health Department.
Okay, thank you so much.
Okay, that is our last outlet that we know of on the line. There were some unknown numbers that dialed in. So I'm going to pause for a second to give any follow-up questions or those other numbers a chance to chime in. Remember, it's *6 to unmute.
Eyewitness News.
Oh, hi.
Hi there. Can you hear me?
We can.
Yes. Yeah, hi. Yeah, this is Carrie Klein from Valley Public Radio. I'm using a different number today, but I had some phone issues this morning, so my apologies. So I'm going to ask about Valley fever, actually. And so I was wondering, has there been an increase in Valley fever diagnoses, throughout all of this? And are there any efforts for those who maybe test negative for COVID but have respiratory symptoms to instead get tested for Valley fever?
So our preference would be that we keep these questions specific to COVID-19 for this briefing. I can have Kim reach out with information to you afterwards, unless she has something.
Oh, sure. Well, I figured. Oh, I'm sorry. Go on.
No, unless she has something she can give you. I'm sorry. She's nodding her head. She doesn't have something she can give you right this very second, but we can set a call up afterwards to respond to Valley fever questions.
Okay, got it. Yeah, well, I figured it was related since how much of an overlap is there between the symptoms of these two diseases, and is it possible that, many folks who think that they have the COVID actually end up, having valley fever instead.
We'll see if Kim can respond to that.
Hi, Carrie. Good morning. As you know, the primary symptoms of COVID-19 and valley fever and other respiratory illnesses can overlap. Fever and a cough is typically what we talk about when we think of valley fever. It's typically what we talk about when we talk about influenza as well as COVID-19. So we know that there are many similarities between respiratory illnesses and the way they present. We have always encouraged people to reach out to their healthcare provider so that our healthcare providers can assess them and do a full assessment of their respiratory illness and test them for everything that they deem appropriate. We have, since the beginning, mentioned, for things like valley fever and influenza, which have a treatment particularly useful when prescribed early on, that we want to make sure that people don't forget about other respiratory illnesses in the midst of COVID-19.
Okay, thank you.
Are there any others on the line with questions?
Yes, Jeanette here with Eyewitness News. Can you guys hear me?
We can, go ahead.
Hi. So obviously, as businesses have been reopening, they have been having to consider and factor in additional expenses that come along with either PPE or just adjusting to the new guidelines that comply with COVID. And so I was wondering, are there any rules that businesses need to follow as it refers to COVID-19 surcharges that they are trying to, compensate for the expenses that are COVID-19 related pertaining to their business?
Jeanette, we're going to have Ryan Alsop respond to your question.
Okay, perfect.
Hi, I think really the most simple, direct answer to your question is that I think we should leave that up to the individual businesses on whether or not they want to, provide things like a COVID-19 surcharge or something similar to that. The county is, as you know, and as we've stated, we have a program called Kern Recovers, where we're distributing, at least initially, $25 million to small businesses located throughout Kern County. I went through some of the stats on that earlier. Small businesses who have been impacted by COVID-19 can apply to receive some financial assistance. We also have a program for PPE, distributing PPE. That's a business expense, an expense that is extraordinary for all small businesses during this time. We've got a $5 million program, at least initially. These are all through the Federal CARES Act to provide, distribute PPE we're targeting 5,000 small businesses in Kern County, at least initially, to provide 2-week supplies of PPE. When you run out of that 2 weeks, you can come back and get another 2-week supply. So we're trying to do as much as we can locally. Obviously, there are other federal programs and things, but locally, those are our 2 programs on the surcharge and what businesses do to address some of their hardship during this extraordinary time would be up to them, and based on whatever their individual market can bear. Thank you.
Thank you. I understand that it is up to the business. As far as the consumer, how should they inform the consumer that there is a surcharge associated so that the consumer knows I am paying extra for X, Y, and Z? How should the business communicate that to the consumer?
Yeah, so if I'm a business owner, right, customers are my livelihood, and I want to make sure that my relationship with my customers is super positive. So businesses would have to make decisions on their own. I mean, simply having something on the bill at the end of the night that addresses something like a COVID-19 surcharge, possibly in addition to having signage in the restaurant, maybe something on the menu up front that might, communicate that that particular cost exists and is calculated into your bill at the end of the night. I'm thinking about restaurants here. Obviously, there are, any one of those, signage, communication, checkout, wherever you are, whatever business you're in. Those are, I think, points where you can engage your customers and talk to them about your business decisions that you're making to operate your business through this extraordinary time. So I hope that answers your
Certainly.
question.
Thank you, Matt.
Yep.
Yeah, I think my question, I think what I'm just trying to clarify is that the business owner is being transparent and clear with the consumer, and doesn't surprise the consumer just, let's say, with the receipt at the end, or I don't know if that makes sense. So I guess my question is it mandatory for a business to put up a sign, a notification, so that the consumer is aware of that surcharge?
Jeanette, as Ryan mentioned earlier, that's up to each individual business, and so we'll look to them to manage that as they see fit and as their customers will appreciate. Thank you.
Okay, so thank you. And one last question, really quickly. It refers to the face mask and the face shield. We've been seeing some people have been wearing face shields. Can you guys clarify on whether they can take the place of a face mask, or kind of the different functions between a face mask and a face shield?
We'll have our Director of Public Health, Matt Constantine, respond to that.
Thank you.
Good morning. So these are important distinctions to make. The recommendation from the state is talking about face coverings, and that is what we've been mentioning from the beginning. You're mentioning face shields. Now, face shields are not necessarily the same. They're good protection from your eyes, but normally used in a healthcare setting. So there's a significant distinction. What we're asking is that face coverings be used, and that a face shield is not in lieu of a face covering. Does that answer your question?
Yes, it does. Thank you so much.
Okay, we believe that was our last outlet. We want to thank you for joining the briefing this morning. We will see you again later this week.
Thank you.